information on prevention, tools for a healthy lifestyle. Make little changes to be the best you. It's all here. A podcast empowering, informing, and motivating Bermuda to live well. Bermuda Health-Abets. Everything from A to Z on healthy living. Brought to you by the Health Promotion and Wellness Office of the Department of Health in collaboration with local health partners.
Welcome to another episode of Bermuda Health-Abets, a podcast where we discuss everything from A to Z on healthy living with a mission of empowering, informing, and motivating Bermuda residents to live well. I'm your host today, Yosifia Spence, and I'm the public health educator for the Health Promotion and Wellness Office at the Department of Health. I want to welcome our Bermuda Health-Abetters, our listeners who tune in every week, and I want to welcome our guests today. We have three lovely ladies from our Department of Health. I have Tina Martin-James, I have Deanne Trott, and I have Isabel Ferbert. And I'm going to just ask you lot to introduce yourselves, tell us a bit more about you, maybe a little fun fact, throw it in there.
Good morning, everyone. I am Nurse Tina Martin-James. I am a community health nurse covering the schools and the clinics. I'm the East nurse. I cover St. George's Clinic as well as my schools in the East. And my background, I'm a registered nurse midwife. I have been a nurse for over 20 years, practicing in various places in the world, and I am happy to be here today.
Thank you so much, Tina. Deanne?
Hey, good morning. My name is Deanne Trott. I am a community health nurse, but doing a focus on nursing informatics, which is a newer branch of nursing. I've been a nurse for more than 20 years, and I originally started my nursing career in Canada.
Oh,
Thank
wow.
you.
Good morning, everyone. My name is Isabel Ferbert, and I am a health visitor. I currently work out of the eastern end of the island. I've been a nurse for 39 years this year.
Oh, wow.
And I've worked at King Edward and the Department of Health for the last 20 plus years.
My goodness, what does it feel like to even be like, I've been working for 39 years in the field? Wow. Thank you so much for introducing yourselves. I want to welcome you. Today, guest, our topic is the heart of nursing, stories from the front line. So we are honoring Nurses Month, which is every year in May. And we just want to hear from our nurses who go into the field every day and work hard for our community. And so we're going to get right into our discussion. So can you tell us a bit about what drew you to nursing in the first place?
Absolutely, Yusifia. For me, nursing was more calling than a career choice. I've always been drawn in helping others, especially in moments when they feel most vulnerable. As a child, I was frequently hospitalized, and I would appreciate the nursing care that was provided to me. And what really stood out about nursing for me is the fact that it combines science with compassion, and I was able to provide care that not just heals the body, but offers comfort to individuals and families.
Thank you. Deanne?
Hi. So my experience was a little different. I didn't know that I wanted to go into nursing. I was a little bit more mature when I decided. I was in my mid-20s when I decided to go into nursing. My calling was more, I wanted to help people. I thought I was going to go into social work or teaching. And my thoughts about nursing was just, I thought, that's just dealing with sick people, and I don't want to deal with sick people. But after some discussions about options, about a career path, I discussed with somebody who told me that nursing, you can do so much with nursing, not just sick people, not working in a hospital. You could be a school nurse, you can be a public health nurse, work for police. There were so many options that I just didn't even think of when I was young about nursing. So I used my feelings about helping people and wanting to do something with caring to take me in that direction. and I was very glad that I did.
Oh, wow. Social work. Interesting. Go ahead, Izzy.
Okay, so my journey began pretty early. In high school, the school counselors, the parents, your siblings are saying, what do you want to study when you graduate? And I had a slew of ideas that I was looking at. But then somewhere around my junior year, tragedy struck my family, and my brother was involved in a road traffic accident. And from there, he was hospitalized for many months. Started
wow.
off in ICU, and then he was on the wards. And each day after school, I would go and visit him. And I was so amazed at the skill set of the nurses, the hospital environment, all the different players in the whole scheme of things. And in the end, when I graduated, I had firmed up my decision to study nursing.
Oh, wow. 3 different journeys. Wow. But I'm glad that it brought you to nursing. And you know what's interesting is the different types of nursing that you mentioned, Dion, because again, it's not all the same. Not everybody's going to have the same experiences. Do you think there's a difference between like a public health nurse and like, a nurse practicing in a hospital? Or like, what would you say the difference is between that?
I think we all start out with the same basic nursing knowledge. We develop, and then we get our calling and interests based on our own personalities, our interests, where we feel most comfortable. And when you're in nursing school, you get exposures to hear about different types of nursing jobs, and you think, oh, didn't know about that. So I think that we all start out with the same foundation, but our individual personalities, and that changes over time because as nursing develops, and because I never ever thought that I would go into an informatics role.
Right.
That was never in the journey when I started, never really heard of it. And the paths change for different people. I thought I was going to be maybe even working in a cardiac unit when I was in school. That's what I did my specialization in, and paths had changed a lot.
Wow, that's really interesting. Yeah, I think I imagine the experience is very different from a ER nurse to a nurse in a care home to a public health nurse. And even within public health, you all work in different sections with different, groups within our population. So I feel like it would vary, with every nurse. So what was your very first day on the job like? Do you remember what that felt like? Does anyone want to share?
Go ahead, Tina.
My first day, it was my first job, and I was 20 years old. And I remember going in and seeing these group of persons, and we were all excited. We have completed our training, and we were ready to embark our journey of being a nurse. But we were all from different backgrounds. And I think once you start your general nursing practice, the experience that you gain in the hospital setting, that's what help you to evolve in the specialist that you want to do. So when you go on the hospital, different floors, the units, and do your orientations, and your interests will basically be sparked there. And for me, I did a lot of med surg and emergency nursing just to gain those experience. But once I started my pediatric nursing, I was more interested in the neonatal aspect, and then I started to observe deliveries, and I was like, okay, this is interesting.
So that's where midwifery came from.
My interest in midwifery, and I practiced midwifery, which gave me a wider scope in all the different aspects of nursing, and public health nursing was always my long-term plan, and I'm here today practicing public health. So it's really nursing from day one is very, very interesting, and you just go with the flow once you're gaining your experience.
Thank you. Does anyone else remember their first day? No?
Go ahead.
Well, it was many, many, many years ago. But I would say as my journey went on, I worked in several areas. So more recently, I requalified and became a specialist community public health nurse.
Oh, wow. Congratulations.
Thank you. The families under the age of 5.
Okay.
And it was such a throwback because during my training, I remember going up into the mountains. You know, I'm a Bermudian, but I trained in Jamaica.
Oh,
and
wow.
that was like an awesome experience. And to think that that was my first choice. I always wanted to work with families and children. And so when I was given the opportunity, I was able to do just that. And just going out into the community, it was like I had finally found my spot.
Very nice. How has nursing changed you personally over the years? I feel like y'all have said a little bit of that, but just a little bit more. How do you feel it's changed you over the years? 39 years, I can imagine, that something has changed, 20 years I know you lot have all been in this for a long time. So I can imagine even your experiences would shape kind of how things have changed for you personally.
Well, yeah, I think so. I don't think that I have really changed. I think that I'm still that person who still goes out to the idea of wanting to care and help people. I think that my knowledge has changed and my wisdom has changed about, and you develop that from your experiences and learning and collaborating with other people. And I think that my understanding of patient-focused health has changed. It's not one size fits all for everything. I think that those perspectives may have changed in me.
Interesting. Does anyone else? Can anyone share a moment from your nursing career that truly touched your heart? Any kind of experiences or memories around that?
Okay, Yusifia, I'll share one. And like Isabel said, she was trained in Jamaica. I was also trained in Jamaica. And one moment that deeply touched my heart happened during my midwifery training. The public health nurse conducted a community outreach program in a low-income neighborhood. And we were running a mobile clinic offering vaccinations and health screenings, similar to like what we would do here sometimes. And a young mother came in with her 3 children, and she looked exhausted and overwhelmed. And as I walked through the process telling her what we were offering and so on, I realized that this was the first time that she was coming in a healthcare setting in years.
Oh, wow.
And as I said, she had 3 children. So we talked about immunization, child health clinics, and I connected her with local resources and follow-up care. And a few weeks later, she came back to the local clinic, and she not just came for herself, but she brought 2 other families in her community and was encouraging them to seek care. So that ripple effect reminded me why public health nursing matters. And it's not just about treating the illness, it's about empowering people, building trust, and creating healthier communities, one relationship at a time.
I think I got like chills listening to that story. No, because you think about I think in public health, a lot of us want to see bigger change, and that's why you do public health. Because a lot of times in school, when you're looking at public health, they're telling you that's where you see the biggest change, right? That's when you can help with population level change. So to hear something like that is inspiring. Does anyone else have any like touching stories, heartfelt one moment from your career?
I think it's, I don't have any one particular one. It just always feels really great when you know you've done your best and people have thanked you, and you can see that it has made a difference in them. They're maybe they lose the fear, or that you're helping somebody going through a grieving period.
Oh, wow.
Very, when they're dying, or somebody, their family member is dying, or the birth of a child. I remember seeing my first labor and delivery as a student. Those were impactful, and then it's always just those moments of seeing, making a difference, people being, or sitting by them when they're in their worst situations or their best situations. Yeah,
That's powerful. What is one of the most challenging situations you've faced on the front lines, and how did you get through it?
Over the course of my nursing career, I can definitely say that the pandemic was the most challenging time. I was assigned to the airport probably that first week, and it was so much that we didn't know. We didn't know the outcomes. We still, were looking at the cases. Were they going to arrive? When were they going to arrive? And my fear was thinking that I have a mother, I have a spouse, I have children. How would this impact my family? And if I'm in a high-risk area working and then going home each day, what would the outcomes of that be? And that really played on my mind for quite some time. And I think I got through it simply because I do have faith, and I recognize that I believe that God has the answers in the end, and that I was willing to accept the outcomes. But definitely it was challenging for me.
Wow. Tina?
COVID was definitely one of the most memorable one, as a challenging situation as well. And we were all working in different locations. And for me, the challenging experience came out of the COVID vaccination campaign. And we were operating mobile clinics at that time in communities that were showing vaccine hesitancy. And then we could also see the communities that were being affected, and people were dying. We were losing family members as well, and colleagues. But we never gave up. Persons were refusing the vaccine, and it was disheartening as public health workers, but we never gave up, and we focused on the public health education and just to increase awareness to help to reduce the hesitancy at that time. And I never forgot a woman who told me, I wasn't going to get the shot, but you treated me with respect and not pressure. And that moment reminded me that trust is earned. And public health is not much about the medicine at times. It's about that human connection.
Tina came with all of the field stories today. That was no, because I think that we all experienced challenge with that time period, being in public health. And even myself, I'm a public health educator. And, I might have a little bit of PTSD from that time period. But so I can imagine. But to hear someone say something like that, it's just it just reminds you, okay, this is why I do this. What about you, Deanne? Do you recall any challenging periods in your career?
There's always you deal with the ups and downs all the time. Like my colleagues here, COVID was a challenge. It put us to the test, but we were trained. But nothing ever really prepares you for a pandemic, I don't think. I think we were prepared. But there's just there's just lots of little things like that.
Throughout the time, just challenges sometimes.
Over 20 plus years of doing nursing, there's just several little stories. Sitting by somebody when they were dying. The scariest one was a young person dying. Watching them go through that stage and they didn't want to die. That was hard on my soul. But yeah,
wow,
there's just that they and it really tested you. Other things that come to mind when I was first nursing is the night shifts and sleepless nights, and they were really hard on me. I think those things I think about.
Okay. Thank you for sharing that. Because, we don't always want to talk about our challenges, right? Because then we have to recall what that felt like when we think about, okay, what was a challenge that I faced? How do you cope with emotional weight of the job? Especially when you're dealing with situations like you had to deal with.
So like what Diane said, it's not easy. And I won't pretend that it doesn't affect me at times, but I've learned the importance of healthy boundaries, self-care, and having support systems like your colleagues, your family. Yeah. And whether it's debriefing, we do that a lot among my team. We debrief about the different situations that we may be faced during the clinics or at the schools or in the community. For me, it's just spending time with my family or going for a walk. And those small acts help me process and keep going on without being burnt out.
And what about you, Isabel?
I would definitely agree with Tina. Recognizing your work-life balance it's real important. I spend time basically getting healthy, just trying so that the healthier you are, the better you're able to deal with a crisis moment, a health challenge, working on the job and encountering complex problems as we do. But like Tina said, I would say that it's real important to take time for yourself, and ensure that you're able to then give back.
Right. Thank you. Keep your cup full so that you can be able to give like you want to give. And I know you mentioned some really emotionally challenging periods for yourself, Deanne. Do you want to share like how you cope with the weight of that?
And so I agree with my colleagues, and it takes time to figure out how when I was a young nurse, figuring that out it took time. But after you realize your support systems, I have a great support system, and talking about it really helps me. Sometimes I would find it in creative ways like art. I did a lot of just journaling things, emotions, how I felt. I used to like to dabble in a bit of creative painting, stuff like that.
That's cool.
So those kind of things help to refocus your thoughts and getting it out. And having support is, I think, and my husband's also a nurse, so we would feed off each other about our feelings, or I would say to him, how would you? I had this situation. Am I overthinking this or what? Yeah. So we'd feed off each other about those things.
It's really good to be able to have that support and bounce off of someone so you can process what's going on. What does compassion look like in your daily work? What would you say that looks like in your daily work?
Because I deal with families, it always goes back to what would I need in this situation? If I'm encountering a young mom with a family, how can I identify her needs and then fulfill those needs. Just recognizing that life isn't all roses and that I am the difference in this person's life at this particular moment. And I need to be compassionate. I need to sort of empathize and then deliver on their needs and make it the situation just a little bit better.
Thank you. I mean, I do imagine empathy has to be involved in your everyday work. Would you say that some of the ways you might show compassion for a situation is that in the event you had a client who had a situation, but it didn't fall under your remit, but connecting them with the right resources, just, going a little bit of extra mile so that, they can actually get the help that they need. But it's not something that you can remedy, but potentially, somewhere or something that could help them. Is that like some of the way that you would say you show your compassion in your everyday work?
I would say definitely as public health nurses, we are linked up to the various resources and we need to know the appropriate referrals that need to be made, just being that bridge to connect them to their needs. There are numerous resources out there, several that directly help families with their the clothing, their shelter, those components, and there are those that help with the physical needs, OT, physio, those sorts of speech, and so on, mental health.
Of course, yes, I'm glad you said that one.
Definitely within our remit to make that bridge to that resource.
Thank you for saying that, because I think at the end of the day, if those basic needs are not met, then you're not necessarily thinking about, other health issues. And for me, I talk about the social determinants of health all the time, because those are things that allow us to access health. If we don't have those basic needs met, what do you do? Because what's on my mind is, okay, how am I feeding my family today? So I do appreciate everything that y'all do and the compassion that you bring to your work every day. Have you ever had a moment where you just broke down? What helped you recover from that? I know that's a question I'm asking you to be a little bit more vulnerable here. If you don't feel comfortable answering, that's okay.
I would say over the years, because I work in my home country, I've had the opportunity to nurse family members, and there have been deaths. And being there has been extremely hard for me. But I just keep on going and recognize that if I need to talk to someone, then I must seek that help. So that would probably be the biggest influence that I've probably experienced.
Thank you so much for sharing that. Wow. Yeah, I don't imagine it really is that easy, because you're not always dealing with the happy moments, right? How do you balance empathy with the need to stay composed and focused?
For me, it's a fine line. And finding the balance is important. And I remind myself that empathy doesn't mean absorbing every emotion. It means acknowledging it and being present without losing clarity. So being grounded in my role as a community health nurse allows me to offer both compassion and stability, which is what families need in their most critical times.
Thank you for that. Right, because you don't want to overstep boundaries, right, within situations, and you don't want to also get too emotionally involved or attached or anything. I can imagine you have to kind of set those boundaries for that. What about yourself, Isabel or Dion? Any thoughts on that? I know you're working in informatics. Is that so? For informatics, you don't necessarily do like patient care, right? It's more around the
the
data.
nursing
It's
team
informed.
and collecting data and working to help nurses. And we do help the patient because the idea is helping patients get the information that they need, and the nurses and the medical teams supporting them in the support that they need, whether it's technology, whether it, information, data sharing, the technology, things that we look at for the future for our healthcare services, like telehealth, just being able to do that way. But as we're reflecting on all these emotional and human components, I think that we as nurses tend to hold a lot of our emotions in, and we don't often think. We try to be a superhero sometimes. We have to try to. We remember we are humans too, and we hurt and we cry and we do feel, and we do get burnt out because we don't take care of ourselves, and we take on a lot of everybody else's. And then on top of that, we're mothers or parents, and we're
caregivers for your home. Parents.
Exactly,
for some people, right?
A lot of us are that middle like that sandwich generation. So
Yes.
we're dealing with parents, and some of us don't live near our parents, or we've lost our parents. So sometimes we get sad, and we might burn out and feel vulnerable, and we forget to take care of ourselves, and we have to realize that there are resources for ourselves out there too. Whether you need to get a group committee together that discusses this, I think this network, what we're doing right now, is really helpful because it puts the story out there that we need to support each other as well, and recognize that we try to be the superheroes, but superheroes have feelings and hearts, and we are vulnerable.
I completely agree with that. Thank you so much for sharing that, Dion. And I will say, in terms of nursing informatics, again, that's very important to the everyday, especially in public health. And I know, like you said, it's relatively new, but informatics is very important in messaging. It's important in, people understanding things when it comes to their health. Definitely. But also it's of course, correct me if I'm wrong, it's how you deliver the information based on the data that we have that supports why we do things, and patients being aware of what they can access or what they need from certain health issues. So I do feel that that's very important. It's helpful in a sense, like you said.
Yeah. And it's from a nursing perspective. So as a nurse, I can support my team in understanding, because I have that medical nursing background, and I can say, this might be something that we should consider in helping our patients or making our work flow. Because we do have a lot. We have a lot of work on our plates every day, and sometimes it's working smarter, not harder, to get things done. That gives us the tools to help our patients.
I agree. Yeah. And a lot of things are moving towards technology as well now, right? So being able to incorporate that and be innovative with how we move through. So can you talk about the role of teamwork in your job? Because, you've kind of brought those components into the discussion already, but just what that looks like, because I know that public health is highly collaborative, right? Definitely. And you work within teams at the clinic, so.
Definitely, you see, teamwork is everything. And no one person can manage the complexity of healthcare alone. We need you as well as our healthcare promoter. And we rely on each other, the nurses, the doctors, the lab techs, the aides, everyone. We need everyone, and the administrators as well, to catch details and support decisions to lift each other up. So we need that support, and all of that helps us to be a strong healthcare team, and it improves population health overall.
Izzy?
From another perspective, Tina and I are actually part of a team.
Okay.
We both work out of the East End, and we have ongoing meetings to see how can we serve this community in the best. And then I'm part of the health visitor team. There are 4 health visitors across the island, and we meet quite regularly to discuss strategies or just bounce ideas off each other to make, our work more effective. So teamwork definitely, for me, is crucial in that those ideas that I may have, just bouncing off a situation with Tina would come from a totally different perspective and say, hey, this would definitely work a little better. So, yeah.
Deanne, I know you work in a team setting and have worked in team settings like throughout your career. What do you think?
Yeah, so I think that we have both teams here, like small teams and larger teams, because we have our own, like I work with several teams because of the work that I do, whether it's nurses or other healthcare providers. But we also have our governing bodies and our nursing associations that have that share information, and we get together and during different times, and they have that's a teamwork component too, to help our country and to support nurses as well. So we have lots of teamwork approaches in things that we do. And when we were in nursing school, that was a big thing. We did a lot of teamwork projects together, team building things. Our workplace does a great job in our team building activities. I think it's so valuable because sometimes we take each other for granted sometimes, and we try to do the heavy lifting on our own sometimes, but without a team to support us, we don't get it done as effectively and efficiently as we could. Having other people's knowledge and support is always valuable in anything you do in nursing.
So would you say your team dynamics kind of help y'all get through difficult days?
Definitely.
Yeah, I think we shared some of those experience, like our, talking to each other and getting reflections, but also getting answers, and because we don't know everything. People often say, "Oh, she's a nurse; she'll know," and really, nursing is so broad. We're in every dynamic of healthcare, and we know because it's so big. We know the proper way to get the right answers. Like we were talking earlier, as you was mentioning about. We know resources. So we might not have the exact answer for your medical condition or a question that you have, but we can go to somebody. We know where to go. The right channel. Like, it's not always Dr. Google, people say, so everybody gets their answers there. We know the evidence-based information. We know the best channels to get the most up-to-date information. And I think that's valuable in a profession that's relies on human care.
Yeah, it's powerful. Have you witnessed a moment of incredible collaboration or kindness among staff? Like, is there like any specific story or situation where like the collaboration was just incredible? I mean, honestly, for me, although COVID was a really difficult time, I would say that was a moment where all staff came together. Absolutely. And everybody in every part that we could contribute to the situation, whether it was the vaccine strategy or whether it was getting the information out there. I think we all kind of came together. I saw teams come together, even within my capacity. I worked with, at a point I worked with a team where youth in sports, when they were youth in sports at the time, the team had people from all different departments on it and working on getting information out there. And yes, we didn't know everything, and it was challenging, but for me, I would say it was very interesting to watch how public health and even other health partners came together to actually address an emergency health crisis. So that was a powerful moment for me. I don't know if anyone else has had any other moments like that throughout your health career.
Well, I would definitely agree with you, Cephia, because having been sent to the airport to work during that time, it was environmental health, it was customs, immigration, it was like a fine-tuned machine. Everything was just going smoothly, and we did have hiccups.
Of course, yes.
But at the end of the day, I am amazed at the outcomes, just how well we work together as a team.
Yeah, wow. Yeah, that was a very interesting time period, right?
Yeah. I think we can all agree that most of what we do is a collaboration. And we do, whether we think about it that way or not, but none of us work by ourselves. We, from doing care on a patient, because we hand over our notes. We work together in a hospital setting. If we were doing CPR on somebody, it's we're life-saving moments. If we just trying to get basic needs for a patient, we'd collaborate and say, hey, do you know anybody with that can get food vouchers or can support, or where to get food? That was social workers and churches, and where do we send them? Whether how do we get the funds needed for certain things? Whether it's sending a patient overseas or getting them the help that they need. We all try to work together in some kind of in anything we do. I think that's key to nursing and healthcare.
Yeah, I know health promotion, like we work closely with the practitioners all the time, right? Yeah. So, I mean, it's interesting because I didn't know that this is what my job would look like, even when I first came into it, right? So, even, me, like, walking down the block from my office to your office to try to talk to you about some project or something that we're working on, or I think that is the part of public health that I actually love the most. And me as a health promoter, I always look at, okay, who's the best expert for it? I will never try to answer something that is not in my purview. Right. Yeah. I'll be like, you know what? I know. Well, you know what? Let me get this person for you because that's the right person to answer that question.
Well, you guys are
right.
Our voice, right?
Yeah.
Sometimes we can't. We're doing our job, but you get us the voice that we need to get out there. Yeah.
Thank you. I do appreciate that, and I do enjoy our relationship. Even regardless through all the challenging times, like we've all talked about. So, how would you define the heart of nursing in your own words?
That's a common thing always being asked as nurses, because nurses, the community, the people see us as always that person that they're scared of the doctors, put it that way. So the nurse is the one that needs to have the heart, right? So to me, the heart of nursing is just being present for the client. It's about being fully there for someone who is in need, and whether this means offering comfort, advocating for their care, or simply listening. It's just the humanity behind the medicine, and that's what persons see when they see the nurse coming into their at their bedside, or coming into the room to triage them, or coming to give them their medication. They see a human, and they want you to share that compassion with them.
Wow.
That was so good.
Yeah.
Yes.
Standing in the gap.
Yes.
Yeah.
Did anyone else want to share their thoughts on what what the heart of nursing means to them?
I think it's just caring. I think we are the carers. We are the carers. We care. We're not just the medicine. And one thing that I just always reminds me is that we're not just nurses. People say, "Oh, she's just a nurse." I want people to know that we're more than just we're not just nurses. We are nurses, and we do care, and we have a purpose more than just putting Band-Aids on. We have a caring element that is our specialty.
I completely agree. Thank you so much. What about you, Isabel? Any thoughts on that?
I would say just providing that contact with humanity, that the compassion, the understanding, the standing in the gap, just ensuring that any client or any patient that you encounter, they have the best outcome as far as you are concerned. Just providing that best experience for them.
And honestly, for me, it's just speaking as a person who has to access healthcare. The nurse is the first person you see, and a lot of times that also determines what your experience is going to be like. I have had horrible experiences. I have had beautiful experiences, and for the most part, that was based on how my nurse came to me, how my nurse treated me. And I think a lot of times, because y'all are burnt out and worn down at sometimes, and overworked, some nurses forget that part of it. And then that's when you end up having those not so pleasant experiences. But I will say, you give everything when you come in to deal with a person. So we have to remember that our nurses, they are doing their best. They're trying to give you the best service possible. And they have you in their minds in terms of, what can I do to help my client or my patient?
Sometimes we get frustrated when we can't get those services immediately or as fast as we know that the patient may need. So it frustrates us as well to know that that we're trying to get things done for our patients in the caring mode that we were.
I can imagine. Yeah, I can imagine. I can imagine the frustration that might come with when you don't have control over getting those things that you need. If you could go back and give your younger self advice as a new nurse, what would it be?
Nothing prepares you for this.
What would it be, Izzy?
I think I recognize this to some degree, but as the years go on, it becomes I become more aware of this, is that disease and illness is no respecter of persons. It affects all races, all classes, all ages. Whereas as a young nurse, I'm thinking they're young so they can pull through. It was something that I had to learn over the years that outcomes can vary for so many reasons.
Disease has no bias, right?
No bias whatsoever.
Wow. What about you, Tina?
As a young nurse, I think I would tell myself, dream big, think big. Because nursing can take you far. And it's not just bedside nursing, it's not just hospital nursing. There's all these various specialties in nursing, and if you want to go in informatics, if you want to be a public health nurse, if you want to be a pediatric nurse, whatever it is, that you have travel nurses now who are doing so well. And I think nursing is bigger than we think when we're actually going in. And for me, that's what I would tell my younger self.
Thank you. Wow. And what about you, Deanne?
I would say take opportunities. Try lots of different things until you'll find your path. You'll find your path. it was scary as a young nurse, and trying to juggle if this is what you want to do, or but there's recognizing that there's several paths, and you'll find your way. And nursing has opened up so many doors. And I came from Canada, and I never thought I would be living in Bermuda.
Oh, wow.
And it's been a great journey.
Yes. I mean, it doesn't hurt your eyes.
Yeah.
You know.
Yeah.
For sure.
So, what would you like people outside of healthcare to understand about nurses?
This has been said a lot so far, that I'd love for people to see nurses more than just caregivers. You know, we have knowledge, we have skill sets, we are critical thinkers, so we are able to educate and advocate for clients, as well as be on committees that are helping decision making and policy makers, just to be there, not just as your caregiver. Yes, we do provide that compassion and that emotional support, but we are more than just that. And we juggle clinical decision making with the empathy, right? And there's just a lot of skill that surrounds nursing, and our intelligence and what we really have to offer clients and their families. And I think for me, that's what I would want persons to see me, more than just a caregiver, but as somebody who is equipped and ready to serve.
Wow. What about you, Izzy?
I agree with Tina. I think we've come a long way since Florence Nightingale. We were the caregivers, but now you have nurses that specialize in law. We have nurse practitioners. We have so many fields where the qualifications or the education that nurses need to undergo can be extremely strenuous. So I would definitely say, yeah, like Tina is saying, we are more than caregivers. But even though that may be the primary focus of our career, there is so much more to a nurse.
I feel like that is what I would say to a younger person considering going into nursing as well.
True.
It's like, you know, think broader than you're just going to be a nurse, you know, because you have the capability to be so much if you decided to go into this. And the thing about it is, when I started my career, actually, I looked at nursing and I was like, not sure I want to be doing all of those sciences. And then I was like, kinesio, I thought about physio. Oh, I'm not sure I want to be doing all of the physics and because I needed to do kinesiology or whatever. And I think that my thoughts around what nursing looked like was so narrow.
Yeah, absolutely. That's what I was saying at the beginning.
Was so
when
narrow.
I was in high school, I was like, no, I don't want to be a nurse. I want to be something.
Yeah, and now I'm here, 8 years later, and I'm like, wow, I pride myself on being an open thinker, but sometimes our mindsets are so much more narrow than we actually think they are. So I would encourage people to just be open-minded and do research. So Deanne, what is one thing that you want people outside of healthcare to understand about nurses?
That we are here. We are supporting everybody, that we want to help, that we have many roles. What else?
We help effect change. We're change
we
makers.
are definitely.
And we're involved at the drawing board to get you that care that you need. And
I'm glad you said that, because I do agree. Like you said, you're not just sitting in a healthcare setting.
No.
Right.
No.
You're looking at advocating for policies that support the public, right?
I was just trying to think of something new that we haven't already said.
I know, because you said a lot,
because
already. I feel like you definitely have even opened my mind as well to think about some of my own kind of thoughts around what nursing looks like and what you put into it. What gives you hope for the future of nursing?
Well, I just got to put it out there that there is a worldwide shortage of nurses. And we need nurses, obviously, in different capacities and in doing the roles that we do. So I think that it's important that people, if you have an interest in helping people, don't be afraid, like we were just talking about, thinking that nursing is just that medical, putting Band-Aid on, giving needles, seeing blood. You know, people, that is a fundamental part of nursing. However, it's much bigger, and the future of nursing will grow. And there's stuff that I'm learning. I'm actually doing my master's in nursing, in the informatics, and what I'm learning about is like the genome, or the genetic components, and DNA breaking down, and there's just so many other elements to come for the future of nursing. But our backbone is caring, and that's how I see the future of nursing.
Wow. Tina, what gives you hope for the future of nursing?
For me, I would want persons who are going into nursing to have the heart of nursing. Because a lot of persons are embarking on this career choice right now because of other opportunities, and the caring is not there. And like Leon said, the foundation of nursing is not just the theory, but it's the practical. Nursing is very hands-on, and it's very human. And if you don't have that part of it, it's hard to have the foundation of nursing. And the foundation of nursing is essential before you can specialize in any other aspect of nursing. So the future of nursing is bright because we have young, talented, bright young people there to embark on this career, but just be reminded that nursing is more than just being a caregiver. It's more.
And it's more than a paycheck, because I was listening to you in terms of what you meant, like some of those other reasons why people would go into something. And I think nursing is one of those fields that you can't be like, oh, paycheck, because the reality is that if you don't give what you need to it when you do get into it, you might not cut it being in nursing. That's what I'm taking from what you're saying. Isabel, what gives you hope for the future of nursing?
I would say, because I've been in nursing so long and I've seen so much new elements come, I would hope that in the future that we are still able to maintain basic standards of care, and that we are not so focused on other factors like computers. We're spending so much time away from
the actual clients.
The clients. I would just the touch element of it. I would just hope that in the future that the new nurses who come in, that they have mentors who can pass on to them the importance of that touch, that basic care, that time that you spend with your patients or your clients, and just retain the humanity of it all.
This has been an excellent discussion, and I want us to continue to honor our nurses throughout May, but also throughout the year, because again, we don't have to wait for a certain time to say thank you to those who are the backbone of our community and health system. If you had one more thing that you would leave with our audience, one line of inspiration or one just important thing that you want the audience to take away from our discussion today, what would that be?
The world needs nurses.
Thank you. I think that's an important one.
Yes, we agree.
Anything else?
Think of anything that we
So the world needs nurses.
That's it in a nutshell.
The world needs more nurses like us, nurses who care,
Yes.
right, and have that
Compassion, heart.
right,
Yeah.
and the knowledge
Empathy.
and the skills that is required to go out there.
So if you are interested in nursing, do the research. You can find out what that looks like in Bermuda, the licensing process, the schools that you would need to go to, all of that information you can find out. I want to thank our guests, Nurse Isabel, Nurse Tina, and Nurse Deanne for coming on today and giving us your time. I know you're very busy with your schedules, and for sharing and for being vulnerable with us as well for our listeners. I want to thank our Bermuda Health-Abetters for tuning in to another episode of Bermuda Health-Abets, a podcast where we discuss everything from A to Z on healthy living with the mission of empowering, informing, and motivating Bermuda to live well. If you want to find more episodes of our podcast, you can go to Department of Health's Facebook or YouTube channel at Department of Health Bermuda. If you have any questions that you like answered or any topics of interest, you can email healthpromotion@gov.bm. Thank you so much for tuning in today.
You have been listening to Bermuda Health-Abets. Please note, anything you heard on this podcast is not a substitute for visiting your healthcare provider. If you have a topic or want a question answered, please contact the Health Promotion and Wellness Office of the Department of Health by emailing healthpromotion@gov.bm or by calling 278-4900. Be sure to listen out for the next episode of Bermuda Health-Abets.